2003. I mean, we know since many years the neuroimmune cutaneous endocrine network, relationship between mind and skin. Since 20 years ago, it was just fantasy. No, we know exactly which is the axis. For instance, the axis between gut and skin, gut and brain. We have to have this vision of the human body. Vitiligo, I told you, I've been involved in the last 3 years of my life in this, in research in this disease. Vitiligo, 2014. What's new in the psycho-neuro-endocrine immune connection and related treatments? I mean, the mainstream medicine is speaking about what we are speaking of since 20 years. Vitiligo has a systemic disease. I don't know if some dermatologists are here today, but vitiligo, it's not a disease of the skin. It's a systemic disease. Look at this slide. Maybe you have some patients with vitiligo. I don't know. And you don't have so many possibilities. Yes, maybe you can use the microphototherapy with UVB narrowband 311 nanometers, but it's not a real therapy. Vitiligo, I told you, in Ireland, the prevalence is 0.3%. In India, is 8%. Which kind of disease is vitiligo, according to your knowledge? Autoimmune disease, do you agree? Yes. Inflammatory disease. Curiosity is interesting. Why in Ireland 0.3%, in India 8%? Do you have an idea about this? It's not genetic, because only 23% of homozygote twins develop in the same moment vitiligo. So 23% is not statistically significant. So what can affect 1,200,000,000 people in the Indian continent? What do you say? No, sun? No? How can you provoke something in a large part of population? Drugs and food. Okay, please focus your attention on this word, food. And now I will scare you. I really will scare you. Okay, vitiligo, systemic disease, autoimmune disease, inflammatory disease. We are understanding the concept of bidirectional crosstalk among all the cells. Autoimmune disease. We have hyperexpressions of some T helper lymphocytes that are Th1 and Th17. Since these subsets are overexpressed, these cells produce a lot of a interleukin that is TNF-alpha, tumor necrosis factor alpha. If you make a blood test in vitiligo patients, you will see that there is a storm of TNF-alpha. Bidirectional crosstalk. Since the TNF-alpha is so high, TNF-alpha bring keratinocytes in apoptosis, to apoptosis. If I ask you, speaking about skin, vitiligo is a problem of which kind of skin cell? Keratinocyte or melanocyte? Which is your instinctive answer? Melanocyte, right. Why? Because it's melanocyte that produce melanin, the pigment. So everybody is focused on melanocyte. Wrong. Because the problem is not mainly the melanocyte. The problem is the keratinocyte. Just think that we have 1 melanocyte, 7 keratinocytes. So, TNF-alpha, super inflammation, keratinocyte apoptosis. If your keratinocytes die, they are not more able to produce some growth factors. Other words, especially the basic fibroblast growth factor that, my friends, is the most powerful stimulation for the melanocytes to produce melanin. This is the crosstalk. Crosstalk. Keratinocytes send a message, hey, please produce melanin. This message is brought by basic fibroblast growth factor. In fact, some pharmaceuticals, rightly, they produce some lotions with basic fibroblast growth factor. Since you don't have so much, I give you. We will see that we do more or less the same. But you understand that if you don't manage the chronic inflammation that is at the basis of keratinocyte apoptosis mediated by TNF-alpha, you will never cure the vitiligo. We will see how to do that. I want to scare you. Why in India 8%, in Ireland 0.3%? The problem is the high level of TNF-alpha, right? Right. But what makes TNF-alpha so high? In other words, that is ROS, reactive oxygen species, free radicals. Free radicals stimulate Th1, Th17 to produce TNF-alpha. TNF-alpha, apoptosis of keratinocytes, not enough FGF, melanocytes doesn't know what to do. Why in India? 8%. In India, food is very spiced. Exactly. And especially, they use a lot of curcumin, the golden herbs, curcumin, that normally maybe you use as antioxidant. Yes, you remember the first page in the flip chart. Some substances are able to invert their effect according to the quantity. If you use little quantity of curcumin, you have an antioxidant activity. If you use, like in India, from the age of childhood, big quantity every day continuously, instead of to have an antioxidant activity, you have a pro-oxidant activity. Today, in the scientific environment, this is the most accredited hypothesis why Indians have this dramatic incidence of vitiligo. Food. Pro-inflammatory food, because reactive oxygen species make Th1, Th17, the pro-inflammatory lymphocytes, to produce too much TNF-alpha. Too much TNF-alpha alterates the crosstalk between keratinocyte and melanocytes. You see that we are changing the paradigm of medicine. It's very hard, the concept, one cell, one treatment. We always have to treat the system, and the system is the psychoneuroendocrine immune network. We will see the therapy later, but I'm just introducing you to the concept of crosstalk, please.
I mean, it's just so interesting, that idea, because from a nutritional point of view, I've often learned that to get high, that you need high doses, at least of extracts of curcumin to slap down the TNF-alpha. And you're saying that it's high doses that are driving it?
Absolutely, yes.
Yeah.
High dosage, right?
Or there's a difference between a high dose of an extract and a high dose of the food, maybe?
Yeah, maybe it's there the different, but be careful anyway with curcumin.
Yeah.
Yeah. Crosstalk, so please don't forget the crosstalk. Some hints.